New information just in from NBC News. NBC News is now reporting that the president is also running what its sources are describing as a low-grade temperature. So some of the symptoms of COVID-19 are now appearing. The president, according to the reporting of NBC News sources, has a low-grade temperature. In addition, he's fatigued but said to be in good spirits. Let's get to Dr. Scott Gottlieb, who's with us now. Dr. Gottlieb, Meg talks of how remarkable it is that this particular cocktail might be going to the president when it hasn't even yet gone to phase 3 trials. What can you tell us?
Well, look, it was a question of whether or not they were going to use one of these antibody drugs or use remdesivir. Remdesivir would have been used effectively off-label. The emergency use authorization for the drug remdesivir, which is an antiviral drug that suppresses viral replication, is for hospitalized patients. Now, I would have thought that they would use remdesivir because there's more data around that drug at this point to suggest that it does have a treatment effect. And we are seeing that drug being used earlier and earlier in the course of the disease. So using it in an outpatient setting in a high-profile individual where you want to provide treatment isn't that far from where the drug is currently being used. The Regeneron product, which I think has a lot of promise, and I've been very bullish on these antibody drugs generally for many months now, it's still very early. We just have very early data on that drug. And so I think from a clinical standpoint, if you have one shot to provide therapy, you want to provide the therapy that you have more certainty around, and that would be remdesivir at this point. And they really only have one opportunity right now to try to get a drug in. They may have another opportunity down the road. We hope not, because that would probably mean that the president is continuing to progress.
Dr. Gottlieb, there's a little more here. The president, in addition to this polyclonal antibodies, he's also been, according to his doctor, taking zinc, vitamin D, famotidine, melatonin, and a daily aspirin. Explain that and how it might affect a COVID-19 positive person.
Well, there's some studies going on looking at famotidine and whether or not it could have a benefit. I think it's very speculative, so I would tend to discount whether or not there's a treatment effect there. There's studies that suggest that if you're low on vitamin D supplementation can be beneficial. But you'd want to be on vitamin D prior to getting sick. Now, I don't think any of those drugs are problematic or could cause harm. I just don't know that they're going to provide a treatment effect in this setting. Really, this morning, when people were speculating whether or not the president would receive active therapy, the discussion was around whether or not they would use the drug remdesivir, which is probably active, but albeit weakly active. It's not a home run drug. Or they would try one of these very early experimental monoclonal antibodies being developed by Regeneron, Vir Biotechnology, and Lilly. They seem to have gone the route of the antibody drug, and hopefully it's going to provide benefit to the president. Again, I'm optimistic about these drugs, but my assumption was that they would use remdesivir because it's sort of the bird in the hand. You have more certainty that you're going to get probably some benefit from that drug, whereas with the Regeneron drug, you might get a lot of benefit, but you just don't know. The data's way too early.
Again, I have this memo from the office of the president from his doctor and sent out from Kayleigh McEnany. I want to read one line to you from the doctor and ask you if there's anything to be read into this. He's being evaluated, the memo says, by a team of experts, and together we'll be making recommendations to the president and the first lady in regards to the next best steps. Anything?
I think that that's standard, medical talk. There's probably other things that they can contemplate to provide supportive care and benefit to the president. I don't think there's any reason to infer from that there's been any dramatic change in his course from what we knew last night. So I wouldn't read too much into that.
Shepard Smith here. Thanks for watching CNBC on YouTube.